Do you want to know what is the ideal breast size for your body? My name is Omar Tillo. I'm a plastic surgeon specialized in body and breast surgery and medical director of Cryo Clinic. In these short videos, I'm going to answer the most common questions about the ideal breast size and all the surgical options available. Ideal breast size for women. So there's no one size that fits all. An ideal breast size is a breast which will fit in proportionality to the aesthetic of the rest of the body. You can look at it in terms of cup size if you want. So a small cup size may indicate that you're using pads to fill the cups, or two big cup sizes may indicate that the breasts are heavy, which can cause back pain or shoulder pain. Can breast implants be too big? Yes, indeed, they can be too big in relation to the body. So the breast, when they're too heavy, they can cause symptoms such as back pain and neck pain. And also big breast implants can cause stretching of the skin, and stretch mark can stretch the breast tissue and can cause sagging of the breast on the long term. And it's higher chances of needing revision surgery for capsular contracture or for implant rupture on the long term. So what are the surgical options available if your breast size is too big for your body? So these are surgical options which aim to reduce the breast size. Option one is the liposuction, which removes the fatty tissue of the breast. Usually the incisions are small, therefore leaves less scarring, but the liposuction is less effective in terms of the reduction. The more effective way to reduce the volume is the surgical excision, where we cut the skin and the breast tissue, and we have more flexibility into how much we want to remove. However, that leaves behind more extensive scar. So what are the surgical options available if your breast is too small for your body? We have three options here. First option is fat transfer, where we remove the fat from unwanted area in your body and we transfer it to the breast tissue. And that will give you a limited amount of enhancement, usually around half a cup to a cup size bigger. Second option is using implant, could be silicone or saline implant. So with those, we can go as big or as high. We keep it to be as realistic within the proportion of your body. And the third option is using composite augmentation. So it's a combination of a smaller implant in addition of the fat tissue. And that works really well to give you more natural enhancement using a smaller breast, which we can put it often over the muscle, which is quicker to recover. So how the implant placement affect the shape and size of the breast after the surgery? So I do get asked this question quite often. There's a conception that if you put the implant under the muscle, they give you more a natural look. This might be true in the very early stages of the recovery when the implant presses on the upper pole of the implant. However, after a few months or a year, that effect becomes irrelevant. The reason we put it over the muscle or under the muscle is it depends on how much breast tissue you have. If you have enough breast tissue to cover the implant, we prefer to put the implant over the muscle because it's quicker to recover, can give you a natural look, and you have enough breast tissue to cover the edges of the implant. However, if your breast tissue is very thin, putting the implant over the muscle can have the risk of seeing the edges of the muscle or the ripples. That's why we put it under the muscle to hide those ripples. In the long term, when your breast tissue becomes thin and at some stage you need to replace the implant, we often move the implant from over to under the muscle in the future.